Noticing a change in her son's energy level at breakfast, Mary asked how he was feeling. He just hadn't seemed himself lately, and she was worried. He explained that he'd been feeling really fatigued lately and was even experiencing shortness of breath sometimes. Mary recalled her own similar experience with a heart murmur and suspected her son may be dealing with something similar. Not wanting to make her son anxious, she explained that his healthcare provider could do a simple physical exam and listen to his heart with a stethoscope. If the provider suspects any issues, they may then follow up with an echocardiogram, which is an ultrasound of the heart to see how your heart is beating and pumping blood. Many people, young and old, have a heart murmur, and most often they're harmless. But it's still important to get checked by a medical professional. If a heart murmur is discovered, it may be innocent and not require any treatment. If it does require treatment, there are several options. Medicine could be prescribed to prevent blood clots and control irregular heartbeats. Diuretics may be needed to get rid of excess fluid in the body, which then makes it easier for the heart to do its job. Or lastly, sometimes surgery is needed to correct certain types of heart valve abnormalities. If you're experiencing shortness of breath or fatigue, you may have a heart murmur or something else going on with your heart. It's worth getting an evaluation by a heart specialist at University of Utah Health's Cardiovascular Center.